Hi, I'm Tracie Clarke, a registered dietitian and nutrition consultant with the Vermont Continence Project through the Center of Disability and Community Inclusion at the University of Vermont. Much of my career has been dedicated to supporting and educating patients with gastrointestinal-related diagnoses. Our topic today will address elimination health, the dietitian's perspective on managing constipation and incontinence, and what I think of first for treatment. As a dietitian, my primary goal is assuring bowel movements are comfortable and that the digestive processes are functioning properly. The million-dollar question is how to get the biggest bang for our buck, particularly when it comes to what foods and/or fluids are necessary to improve these body functions. Constipation can be frustrating, complicated, challenging, and time-consuming to manage. You are not alone in this struggle. We've all heard that fiber and fluid will fix constipation, the simple and obvious next steps in treatment. But in this video, I want to offer a different perspective that is aligned with the phases of treatment that you are learning about from Kelly, our nurse consultant. Just like in the videos from our nurse consultant Kelly, I am here to tell you that the cure occurs in two phases, acute treatment and maintenance treatment. Today we are just going to focus on the acute phase. I like to think about things in short checklists. In the acute phase, I think of three things: medication/treatment, fluid intake, and getting to know your child's current routine. The treatment isn't that straightforward. Food and hydration are often the most difficult to understand. The challenge is that fiber and fluid are pieces of the puzzle. There are some situations where you can do everything 100% right from a nutrition perspective, and your child is still constipated. We all have food we refuse to consume because we have had a negative or uncomfortable experience with it. If your child feels uncomfortable because of constipation, the number, variety, and volume of foods they accept will likely get smaller over time. Adding foods, especially new foods, gets more challenging, and adding fibrous foods seems impossible. And life isn't perfect, and neither are our diets. Some children will always be picky eaters, and consistent intake will vary from day to day. The good news is that many children become more open to trying foods when they have regular bowel movements because they feel better. The discomfort of constipation is often a cause for food selectivity. This is why medication is necessary for effective treatment. We'll talk more about this in the next slide. Miralax and other laxatives are important tools that are necessary in helping to train the gut to create more consistent bowel movements, especially in the setting of functional constipation. In addition, medication treatment is necessary to help reestablish the gut-brain signaling for the rectum to function properly. The gut-brain signaling is the connection that allows you to feel, interpret, and respond to activity in the gut. The steps needed to help with improving food intake are as follows. Number 1, establish regularity. Number 2, retrain the gut-brain signaling. And number 3, decrease discomfort. Some kids just need the help of medication, and that's okay. Medication, in many cases, is a temporary solution to getting things moving. Once a treatment plan is in place, the next step is looking at your child's fluid intake. So why fluid? Most people have heard of fiber as an intervention for constipation, but we talk about fluid less often. As a dietitian, I see fluid as even more important than fiber during the acute phase of constipation care. This is because water helps keep poops soft. Remember, the longer stool is withheld in the rectum, the harder and drier it gets. A child who withholds likely needs more fluids. Osmotic laxatives like Miralax don't work without fluid. Laxatives just make water more accessible, but water actually needs to be available. And fiber relies on available fluid. Increasing fiber intake means more fluid needs to be consumed as well. So let's talk more about this. So how much fluid does your child get? and how much do they need? It is important to have a sense of how much fluid and fiber your child is getting. Often, fiber is the first item on the checklist, especially adding more fiber. However, in my experience, most kids aren't consuming enough fluid. Interestingly, the body is made up of 60 to 70% of fluid, so not only does poop need more water, but so do other bodily functions. So your first step is to figure out your child's average daily fluid intake. We encourage you to take a 2 or 3 day inventory of your child's fluid and fiber intake using the fluid and fiber tracker in the parent manual. This form will also guide you to learn about your child's fiber intake. Remember that fluids don't just exist in drinks like water, milk, or juice. I also think about foods that contain liquids such as popsicles, yogurt, applesauce or purees, Jell-O, pudding, cooked grains, fruits and vegetables. As we know, fruits and vegetables are often what we want kids to eat, but can be the foods that are the most difficult to accept. If you discover your child needs more fluid, here are a few suggestions to help increase their intake. Use a new fun cup. You could add stickers or markings to already preferred cups, or silly straws. Or pair it with an activity, such as before going outside or coming back inside. Or you could try adding flavors, dilute juices, or offer a milk or plant-based alternative. You might be wondering if you should just start your medication, fluid, and fiber interventions all at once. But if you don't know the source of your problem, you're only treating the symptoms and not getting to the root. Before making any changes, it's important to have a good baseline of your child's elimination routines and fluid and fiber intake. Do this before making any changes. By doing this, you'll have painted a picture of your child's diet and elimination health and know how to intervene effectively and efficiently. Constipation is complicated, along with all the puzzle pieces that come along with it. Some puzzles are more challenging to put together than others, but we always find a way to pull it together. Start with a small, tangible goal. This is much less stressful than trying to add multiple things all at once. Thank you for your time.
The information contained in these videos is for informational purposes only. It is not a substitute for professional health or medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider.